I've always been a strong believer in the power of nutrition. When I started working at CHOP in the mid-90s, the diet was a last resort. And in fact, in my clinical trial where we compared fasting versus a gradual initiation, those children had been on an average of 8 or 9 drugs before they were referred to me. Now I would say I get referrals after the 2nd drug, they're about to fail the 3rd. So the diet is being used much sooner. The other thing that has changed is I think initially we were thinking about it more as a 2 to 3 year therapy. And what we found as we come down on the dietary therapies, not everyone can come off them completely. They may be able to sustain a low ratio diet, but they can't come on to regular food, then seizures return. And there are more families who are choosing to remain on a 1-to-1 ratio because that's how their child is seizure free, that is how their child is functioning. And rather than taking medications, they've chosen this to treat their child this way. What also has changed over the years, if I may back up and tell you this, is that we've used the diet in more difficult situations. I used to maybe use the diet once a year for someone in status epilepticus. That's now becoming a hot topic, and we use the diet for status between 5 and 8 times a year now. So even there, it is being used and requested sooner than just as a last resource.